to have you with us today to talk about an issue that currently affects many children and youth, school avoidance. If you've attended one of the other children's mental health trainings with Karen and myself this year, we're glad you're with us again. If this is your first session, we're happy you're here and hope you join us for more discussions in the future. You can always find information about PACER's upcoming trainings and about all the many programs PACER Center provides for families of children with disabilities on our website at pacer.org. You can also view recordings of our trainings at the PACER Center YouTube channel. It sometimes takes a few days to get the videos posted once we've provided them live. So if you want to review this one again, check back maybe in a week, you'll probably find it there. So our typical training format consists of about 40 minutes of presenting, followed by 20 minutes or so at the end for questions and discussion. Feel free to put your thoughts, as Jamie said, and questions in the Q&A box as we go, and we'll get to as many as we can at the end of the training. Next slide, Jamie.
Jeannie,
Yeah.
I just want to mention, someone wrote in the Q&A that they're having a little trouble hearing you. So maybe if you could
Okay,
a little
thank
bit
you.
louder. Yep, thanks.
Appreciate that. Yep. All right. So by way of introduction, my name is Jeannie. My pronouns are she, her, and I'm an advocate and trainer for PACER's Children's Mental Health Project. My background is in education, family support, and trauma growth practices. I'm also the parent of two now grown children who were on IEPs. I'll be presenting during the first half of the training, and you'll hear from Karen, my colleague, for the second half. Karen?
Hi, everybody. Welcome. Thanks for joining us today. My name is Karen Malka, and I am also an advocate here at PACER, as well as the coordinator for the Children's Mental Health Project. I've been at PACER for a little over 3 years. Have a background in education and also have two daughters who also had IEPs and grew up with mental health and learning needs.
All right, next slide, Jamie. If you can't hear us still, put another note. And Karen and Jamie, can you keep an eye out for that? I'm not sure what the difficulty is there, but I want to make sure that everybody can hear us.
I'm monitoring, and we have somebody who said they can hear just fine. So I just did send an answer to, they could check their computer volume on their side. It might help.
Okay, great. Thanks, Jamie.
Mhm.
All right, so key takeaways. School avoidance is a big topic with many facets for discussion. If you have a child that's struggling with it, you're aware of it. It's complex, it's often multifaceted. So today we'll provide an overview about what school avoidance looks like, reasons a student might be struggling to attend school, and options for interventions and supports to help our kids reconnect and participate successfully in the classroom. Next slide. This thought bubble includes words and phrases often associated with school avoidance. You'll notice that many of these phrases can be linked to a couple of broad themes: unidentified unmet needs or lagging skills, which may include social emotional as well as academic skills. When a child is displaying school avoidant behaviors, they're attempting to communicate that something isn't working for them. Often, when we dig a little deeper, we find that the student is struggling in an area that isn't yet adequately understood or addressed by the adults around them. When expectations exceed the skills or developmental capacities required for a student to, for a student to meet those expectations, oftentimes we see behaviors as a result. I am missing a couple of notes here.
And Jeannie, we are getting a couple of people saying they can hear others clearly, but if so, I don't know if you can move just closer to your laptop microphone and see if that helps.
Okay, yeah, I will do that. I'm not sure what the challenge is here, but thank you for keeping me posted. I will try to attend to that. So when we humans are required to navigate an experience that we feel is beyond our ability to manage, our first instinct is to escape or fight back or shut down. Actually, I think I am off track, Jamie, on my slides for some reason here. I apologize to. Maybe not. Thanks for hanging with me, everybody. Um, so, as I was saying, our first instinct is to escape or fight back or shut down. Children and teens are the same, but they often lack the skills and experience to recognize why they're distressed, how to ask for help, and from whom, which coping options are available to them, and what skills they need to learn and practice to be able to work through the problem. For students, distressing circumstances at school might include activities that seem ordinary to adults, such as riding the bus, walking in the hallways, playing on the playground, taking a quiz, athletic performance in gym class, or sitting quietly in the classroom. In fact, these everyday experiences may present hidden challenges no one else sees. A child might be completely overwhelmed by noise and chaos on the bus or in the hallways, or they might have to face another student who's unkind to them at school every day. They might be struggling to keep up with schoolwork or participate in class discussions due to a learning or other disability, or afraid of taking a test they believe they might fail. A good starting place for thinking about school avoidance is to view behaviors through a lens of empathy. The inclination to become aggressive, to withdraw, seek emotional safety with someone we trust, or to physically or mentally escape, such as by leaving the classroom space or using technology as a form of cognitive retreat, are perfectly normal, protective human responses when we feel incapable or poorly equipped to meet expectations. Next slide. When avoidant behaviors go unnoticed or are insufficiently addressed, the outcome can be costly. The student may miss instruction and as a result fall behind in academics. Peer relationships can become difficult to maintain and adult relationships strained. The student might struggle to follow behavior policies, resulting in suspensions. They might face truancy consequences. They may exhibit behaviors that require interaction with a school resource officer or police, leading to involvement with the juvenile justice system. Next slide. So, from the perspective of the child, going to school may not make sense if they believe no one understands them or that no one knows what to do to help. Kids and teens are often not even aware of or able to articulate that an underlying need exists. What's apparent to them is that they're unable to cope, perhaps feeling they're not measuring up, and they don't know why or how to find a way forward. Some of the phrases in this slide might sound familiar to you. It can be easy to dismiss complaints. Sometimes a child is just having a tough day or a difficult week. However, when you're seeing an increase in anxiety about school or noticing patterns of avoidance, paying attention to how your child is communicating distress or frustration can provide important clues into negative feelings and perspectives. Statements such as these provide important opportunities to explore concerns with your child. For example, if your student says, "Everybody at school hates me," you might respond with, "It sounds like friendships are really hard right now. Can you tell me more about what's happening?" Or if they state they're afraid of failing a class, you might say, "I understand. Schoolwork can be really stressful. Can you share more about what's difficult for you? Maybe we can find a way to help." Next slide.
I'm still getting a lot of people reporting that your sound is a little soft. And one person did say that he or she left the webinar and came back in and that fixed that for them. I'm sorry, do we want to just pause here and give people an opportunity to do that? I know we have so many people online. I just hate to to cause issues for a lot of people. We are getting a lot of people saying the sound is just fine.
It's up to you, Jamie. I'm not doing anything differently than I usually do. I haven't changed anything about my laptop, but we definitely want people to be able to hear. So I will, you're the tech dude, so you decide what you think the best route is.
All right, well, let's just, yeah, I'm just saying if you could speak louder, but then I get another one saying works well, sound is fine here,
Okay,
so I'm
why
good.
don't I go
Uh,
with speaking louder and
okay,
just let's see how that goes instead of
somebody said to
me
go back to
speaking
the
and then
previous
you.
slide, but I'll do that real quickly. Again, I put in the chat the link to the slide deck, and also it will be on a follow-up email that you'll receive one day after today's webinar. It's also on your reminder email that you received around 11 a.m. Central Time. So if you look for those emails, you'll have a link to all the handouts and the slide deck. So
Okay,
sorry about this
Yeah, I
interruption.
think I think Jeannie, just speaking a little louder, because I know on my end, Jamie, I can hear you much better than Jeannie, so,
okay, I
okay,
will see if I
thank
can
you.
get louder. So, can you go
Oh,
forward one slide, Jamie? We were on this one. So, we were just talking about communications from kids, things that they might say that might indicate that they're starting to struggle with anxiety, and how we can explore kind of pursuing further conversations with them if that's something that they're able to do to understand what might be behind that. All right, so next slide. So, school avoidance isn't itself a diagnosis, but it may be an indication of other formal diagnoses such as anxiety or depression, which are important considerations that may make it hard to get to school or to stay in school for the full day. Your child might experience very real physical symptoms resulting from emotional stress, such as headaches, stomach aches, digestive issues, chest pain, palpitations, joint pain, or sleep difficulties. Patterns related to physical symptoms, such as an upset stomach right before school every day, or a severe headache during a specific class or time of day, might indicate an unidentified problem with your child's school participation. Physical symptoms could also indicate an unidentified health problem. If your child shares with you that they're experiencing any kind of physical discomfort, do consult a medical professional to rule out or address a potential health issue. Some parents report that avoidant behaviors emerge gradually over weeks, months, or years. Others see a sudden refusal to go to school or stay in class. When a child abruptly refuses to go to school, it may be that a specific event triggered the behavior. In this case, it's important to reach out to the school to gather information regarding incidents or changes they've observed so you can begin working together to address the problem. When avoidant behaviors develop more gradually, it could indicate that the student has needs that haven't been identified or addressed over an extended period of time. And as the social and academic demands of school increase with each grade level, disability needs often become more apparent and the struggles more significant for the child. Next slide. As we discussed a moment ago, children may use a range of behaviors to communicate that something isn't working for them at school. This slide represents a spectrum of examples starting with internalized behaviors and moving to externalized behaviors on the right. Not all children will move along the full continuum, but this visual is intended to help you consider indicators you might see as avoidance emerges as a concern. Sometimes avoidant behaviors are rooted in separation anxiety, wanting to stay close to a parent, or preferring to stay home if that's where they feel safe and in control of their environment. If stressful factors exist within the family, such as a parent who is ill, a student may be reluctant to be away from home. Some kids will become quietly withdrawn or disengaged from school. They might put their head down on the desk, participate less in class conversations, or stop interacting with peers. A child might leave the classroom or even the school building. They might exhibit behaviors that are disruptive to others, such as yelling or becoming physically aggressive in school or at home. A child might even show the full spectrum of these internalizing and externalizing behaviors at different times and in different situations. When we see these behaviors, what might the student be attempting to communicate to us? A child who complains about being in the classroom may be experiencing a problem with learning, attention, processing speed, or another disability. They might be overwhelmed by the amount of work or to know how to plan and organize tasks. They may not be able to sit still or maintain focus long enough to hear the information they need to learn. Content may be taught so fast that they can't process the information quickly enough to keep up. They may not be able to reliably remember terms or concepts. If a child is isolating from social interactions at school, it may be that they need help building social communication, problem solving, or self-advocacy skills. By the time children are exhibiting behaviors that are close to the externalizing end of the spectrum on the right side, parents are often able to look back and realize that school anxiety and the start of avoidant behaviors were apparent earlier than they or school staff may have realized. When you begin to notice patterns of avoidance or complaints about school, it can be helpful to keep a journal or spreadsheet to track symptoms and complaints and consider possible correlations. So some early indicators of a child's emerging anxiety about going to school might include a refusal or a reluctance to get ready for school in the morning, sudden changes in mood on school mornings, reluctance to go into the school building or a specific classroom, increased calling or texting parents during the school day, asking to leave school to go home, decreased academic performance. And you might observe that your child appears to manage well at school, sometimes, especially earlier on, but needs to release stress when they return home. So this release might appear as anger, explosiveness, anxiety, withdrawal, extreme fatigue, or refusal to do homework. Some kids contain emotional stress at school when they're struggling. The anxiety builds through the day and it needs an outlet, which means it's sometimes released at home. For this reason, even if the child isn't yet actively avoiding school, it's important to address your concerns with staff. Before we move on to talking about strategies to address concerns, I want to note the importance of gathering student insights to the degree they are able and willing to provide perspectives and recommendations. Sometimes we work so hard to come up with solutions and interventions to support a child who's having a hard time that we underestimate the value and importance of integrating their own insights, ideas, and recommendations. It's often difficult for children and youth to express what they're feeling or to articulate what's going on at school. Additionally, when a student feels that no one understands them, sees the good in them, or wants to support them, it can take time to rebuild trusting relationships at school, home, or even with outside providers. Rebuilding trust may also require additional planning for communication, skill building, and self-advocacy practice. When I'm working with parents, I often suggest that they initiate casual discussions with their child while doing an activity together that they both enjoy. This relieves the pressure of having a focused one-on-one conversation, which can feel overwhelming to the student. Being mindful of how much conversation your child can tolerate in one discussion, you can introduce questions such as, I've noticed that you seem to be having a hard time at school or with a certain class. Would you be willing to share more about that? Can you describe what it's like for you? Tell me about what's happening that's causing stress. Maybe we can come up with some ideas together to solve the problem. When you feel good at school and things are going well, what's happening? What class are you in? Are there people who are teaching or helping in a way that works for you? Or, if there was one thing you could change at school, what would that be? When a student articulates the ways in which school is challenging and ideas for improvement, it gives us insights into the circumstances and environments at school that may require more support. Sharing what does work for them when they feel successful, happy, and supported allows us to use these insights to advocate for positive change and strategies that reflect their input. Not all students, as I said, are able to clearly articulate answers to exploratory questions. You know your child best. If asking questions will be stressful for them, an exploratory discussion may not be the best strategy. If they seem willing and able, the simple exercise of asking the questions even if they're not able to clearly articulate an answer, provides two added benefits. First, the student learns critical thinking skills. When we make it a habit to ask for their input, they learn to reflect on what they might need for support and how to articulate challenges and ideas. Second, the student learns that their needs, ideas, and opinions matter. Asking for a student's own recommendations empowers autonomy, self worth, and self advocacy. And I'm going to pass it along to Karen now.
Okay, thanks. Next slide, Jamie, please. Thanks.
Karen,
Yeah.
maybe before you get started, and I'm sorry, I should have alerted people to this before, but people can, if they're having trouble hearing, can also turn on closed captioning. Should be available on the Zoom bar for you to turn that on. I can't turn it on for everybody here, but that's just another option for people who are having trouble.
Thanks,
So,
Jamie.
yep.
Okay. Considering what is preventing your child from successfully getting to school or staying in the classroom can help you respond to them in a way that validates their feelings. When they feel like you are hearing their perspective, they may be more willing to hear your perspective. It can be helpful for parents to reflect and identify on why it is important to them that your child gets to school and how your response to behaviors can either support or make it more difficult for a child to get back into the classroom. At school, children learn a variety of skills that will help them to be successful and independent in the future. Young children learn basic academic skills such as reading, writing, and math that are foundational to being successful in school as they grow older. For high school age children, parents and teachers are likely thinking about earning credits and making sure that a child is on track to graduate. School is also a place for children to learn to build relationships with peers and adults who are not their family. Being able to build these relationships requires children to learn social skills. School is also a place where children learn about social expectations and work on building behavioral skills that help them to meet these expectations. A small study of 519 families surveyed reported that more than half of the students and their parents were judged for not being able to get to school, and 68% were identified as having a disability or special needs. The study identified protective factors that help reduce and prevent the school avoidant behaviors. These protective factors included students experiencing school as a safe place with a positive environment that creates a sense of community and belonging. Students could identify a trusted adult that supported healthy habits, daily activity, and incorporated students' interests to motivate them. Participating in school teams, clubs, and other school programs that provide positive opportunities to build peer relationships. Another protective factor for students with disabilities was having and knowing how to access supports, accommodations, and services, and having their needs met and understood. Next slide. When a child cannot get to school, stay in school, or engage in classroom activities, it can be helpful to consider if there are behavioral skills that the child struggles with. Identifying the needs related to these skills can be an important first step to better understand how to support the student so they can return to school or the classroom. To help us understand the complexity of behavioral expectations at school, we attempted to compile a starter list with examples of behavioral skills that are expected in the school setting. You may also have a completely different list of behavioral skills that you expect at home or in the community, but lists like these can be limitless. Being deliberate about what the behavioral expectations are in certain settings helps us better understand where to focus our efforts when behaviors become challenging. Looking at these examples of behavioral skills at school, such as paying attention, following directions, waiting your turn, being quiet, staying in one place, taking turns, tolerating certain environmental conditions, ending a preferred task, turning in and completing homework, are just a handful of the daily demands in a school setting. For children who already have vulnerabilities to challenging behaviors as a manifestation of their disability, not being able to demonstrate or apply these environmental skill expectations along with other unmet needs or differences can be a recipe for disaster. A child who may be lagging in these skills may find relief by avoiding school. It's important to remember that avoiding school is a symptom. It's not the underlying problem. Digging deeper to discover the underlying issues that are causing the symptoms of school avoidance can help inform both parents and school how to best help the student. Next slide. What does school avoidance look like at school? One of the expectations adults have of children is that they will regularly attend and participate in school. Just like the behavior continuum that we looked at earlier with Jeannie, school avoidance is also on a continuum and can present in different ways. When students display behaviors to avoid school, the items on the left of the continuum are usually easier for adults to manage, and therefore it may be more difficult to immediately recognize these behaviors as school avoidance. It can be easy to dismiss some of these behaviors as a child is not trying, they're being defiant, or being non-compliant. When school avoidance has a larger impact on a student's attendance record, adults can usually more easily recognize that there is a problem that needs to be addressed. A child's ability to make educational progress is typically affected when attendance is impacted at all these levels, but it is obviously more impaired when a child cannot regularly get to school. It also tends to become a greater problem for parents who may increasingly be missing work to stay at home with their child, or who may get notified from the school or county that their child is truant. In the short term, students may have poor academic performance and family and peer relationship difficulties. Long-term consequences may include academic underachievement, not completing high school, employment difficulties, and increased risk for psychiatric illnesses. Oftentimes, parents can feel judged by the school and feel that the school does not understand that they are doing the best they can as a parent. Schools may also not be able to relate to the parent experience of having a child with a mental health challenge. For example, some days getting your child out of bed and dressed for the day is progress, even if they are an hour late for school. Schools may not realize how much parents are doing behind the scenes to try and get their child to school. Because of this, effective and open communication between the school and the parent is so important, especially when their perspectives about how to support a child may differ. Effective communication includes making sure that you explain your own needs and experiences while also listening to the needs of other adults who are trying to support your child at school. Next slide. So how do we support our child when they are avoiding school? If the student already has a 504 plan or an IEP, you may want to request a meeting with the appropriate team members to discuss your concerns and determine if changes are needed to better support the student. Remember, their special education supports should build the needed skills that were identified in their school evaluation. These skills are based on the student's strengths and interests to provide access to education. Sometimes the needs of a student can change due to a new family circumstance, new diagnoses, recent medication changes, or therapeutic treatments, or new academic or social emotional challenges. When this happens, a new standalone functional behavior assessment could be completed, or parents or the team could decide a reevaluation may be needed to gather more information to guide the next steps of support. If the student does not receive special education, the parents and school can discuss if an evaluation may be warranted to determine eligibility for those supports. In addition to special education and academic supports, You may want to ask the school or IEP team what mental health supports are available through the school. A growing number of schools offer children's therapeutic services and supports, known as CTSS, where outside therapists come into the school to provide therapeutic services during the school day. It can also be helpful to ask if there is a social worker, school psychologist, or other appropriate supportive adult who could build a relationship with the student. We know that when a student has the support of a trusted adult, they feel safer at school and are less likely to experience school avoidance. Many schools also offer social skills groups to meet the needs of students who need help building and maintaining peer relationships. Participating in extracurricular activities is also a great way to foster a sense of belonging and build positive peer connections. Outside of school, you may want to connect with your child's primary pediatrician to rule out any possible underlying physical illnesses, share your concerns, and discuss appropriate next steps, which may include having an evaluation with a specialist to help determine if there is a disability and/or mental health diagnosis. Having this information will help parents and the school better meet the student's needs. If your child is not working with a therapist, that may be something you want to consider. And if they are currently working with a therapist and their mental health needs have increased, you may want to explore the other more intensive treatment options, such as crisis stabilization programs, day treatment, and residential treatment options, all depending on the severity of their mental health needs. Therapy and medication often work best when partnered together to reduce the symptoms of mental health disorders, such as, but not limited to, anxiety, depression, impulsivity, or distractibility, while they work on building the coping, regulation, communication, self-advocacy, and academic skills they may need as they work towards wellness. If you need additional help finding an appropriate provider, another good option could be to reach out to your medical insurance company to see what specialists are in your network and accepting new patients. You can also contact your county children's mental health department. Every county in the state must provide these mental health resources. They can help you navigate and gain access to mental health resources in your community. Another option is to call the crisis number or 988 if you cannot get your youth to get up in the morning and get ready for and go to school. You could call the crisis line to see if they can assist you and your child. They may be able to help you problem solve or identify possible next steps in getting your youth the support that they need. These calls can add to the history or documentation that can demonstrate to the county, school, and other providers the seriousness of the issue and level of need, as well as demonstrate the frequency of times you have reached out for help. This documented information can be helpful when working to access more services or when working with a truancy officer. Since I mentioned truancy, I do want to mention that receiving a letter regarding truancy can be intimidating for families during a time that is already difficult. Being referred and having to appear in court for truancy can be nerve-wracking, but one thing families can do is to be sure to document all of your efforts to get your youth to attend school, as well as your efforts to get them the support they need. Essentially, that is what the court is looking for. They're not looking to get youth with mental needs or their families in trouble. They do want to ensure youth do not fall through the cracks, and sometimes a truancy officer can become an important part of the problem-solving team for a child who is experiencing severe school absenteeism. If your student is struggling to get to school, know that they may need a supportive team of school staff and teachers. The special education team, parents, and possibly outside providers to identify and address the underlying needs that are getting in the way of them attending school and participating in daily activities. This will look different for each student and will depend on those underlying contributing factors. For example, a student who has not been able to get up or leave the house for school may start by practicing a getting ready for school routine to whatever extent that they are able, until they can take the next step, which might be getting in the car or walking to the bus stop. Some students will gradually get in the car and drive to school, but may need to do this for a few days or weeks before they can get out of the car. Building relationships with trusted adults at school during this time can be critical to helping the child successfully re-enter the building and engage in school tasks. Sometimes it starts with a daily call or quick video meeting for a student who is not yet able to leave their home. Once they're able to make it to school, that staff person will sometimes come out to greet them or help them transition to class. As mentioned previously, if the student already has special education services, you can work with their IEP team to come up with a plan to support helping your student return to school. If they do not have special education services, you may want to consider if an evaluation is needed. If you are unable to make progress on helping your youth return to school, you may need to explore other treatment options that will help your child on their path to wellness. Working with their medical providers will help you decide if they need more intensive therapeutic supports. Next slide. School avoidance is a tricky topic to address. Today's workshop has attempted to help you understand school avoidance through the lens of mental health. Being proactive by learning how to recognize the warning signs of school refusal is a great first step. Understanding the importance of assessment and how it can inform educational planning and using positive supports in the interventions, including plans for re-entry, are key to helping decrease the likelihood of school refusal. Remember to focus on your child's strengths, document your efforts, and work to collaborate with the school when challenges occur, and know your school's attendance policies and truancy laws. Finally, know how and when Section 504 and special education can help. Not every child who is avoiding school may need an evaluation, but if your child is school avoidant, don't ignore that it may be about an unmet need and start an action plan to address the situation. Next slide. So this slide is just showing in February and March, we have an upcoming parent leadership training. So this is just information about that. And the QR code also, you could scan that to get more information about registering if you're interested in that. So I think right now I'm going to go ahead and open the Q&A and see if you have some questions. Feel free to continue to put those in there, and we're going to go ahead and answer as many as we can as time allows. Um,
Karen, I logged off and back on to see if that helped with volume, but
yeah.
it meant it eliminated my ability to see the Q&A that was in there, so I'll
Oh,
let you
okay.
lead.
That's okay. I will
Can't see
read
the
them
questions, so
out loud.
thank you.
Let me just see. Um, So it looks like those are the answer. Okay, here we go. I think I'm at the top. What do you do when a child has suicidal ideation, wants to harm self, and the school refuses to write a safety plan? Anytime the school is refusing to do something that you've requested, the first step would be to ask the school to put their refusal in writing. If they have an IEP, a safety plan could be part of the IEP, and um, the school not being willing to write a safety plan would be a refusal to make a change to the IEP, and that would require a prior written notice. We can, I would say also reach out to a PACER advocate. We can, we don't have time today to go into all of the like what a prior written notice is and what certain things are, but there is a process to help you support your student in that situation. What do you do when you've had 6 IEP meetings related to attendance, yet the school will not add the plan from the FBA to the IEP? Again, Look, usually the FBA will lead itself into a behavior support plan. An FBA is a type of evaluation, and you have the right to disagree with the results of that evaluation. So if you feel that the FBA was not comprehensive or it didn't give a accurate view of your student, you can disagree with that. And then there's a process to go to dispute resolution meetings such as a conciliation. And those are sometimes times where a PACER advocate can step in to help advocate. Um, and again, speak up with your team, share your concerns, and ask any of their refusals or proposals to be put in writing. And Jeannie, if you have something to hop in, it
Yeah,
looks like you want to
okay.
say
I
something.
would just
Yeah.
encourage that parent that that's a great question. And as we were talking about through the training, that gathering of data and insights is critical when it comes to school avoidance. When a student is struggling with anxiety, trying to root out where that's coming from comes through sources like an FBA. Um, there is also a school avoidance survey assessment that can be used, but staying on top of the school in terms of are we gathering the data that we need to really understand why this is happening so that we can create an effective plan of support.
Next question. How do you get the school to collaborate on how to keep the child at school? They are perfectly happy allowing my child to sit in the nurse's office all day. That's not FAPE or LRE. You're absolutely right. That is not FAPE or LRE. I would you can ask to have a meeting, share your concerns, and use those terms. I believe my child is not receiving FAPE and they are not in their least restrictive environment. By sitting in the nurse's office all day, my student does not have access to their peers and therefore would not be their least restrictive environment. Um, and it would sound like also if the student is wanting to just be in the nurse's office all day, it sounds like a good time to work with the team to create a plan. Again, it sounds like maybe you've tried that and you're struggling to get them to collaborate. Again, getting back to the process by asking them to put things in writing, making your requests and having them put their responses in writing can get you back in the process. Um, Also, parents do have a right to file a complaint with the Minnesota Department of Education if you're feeling that your student is not receiving FAPE or their IEP is not being followed. Some other things also, if you're finding that your student is wanting to be in the nurse's office all day, considering what other supports need to be put in. Or sometimes, is going to the nurse's office happening in the afternoon? Can they maybe only tolerate school up to a certain time? Would having an altered school day help? Just thinking creatively with the team about some supports that you could put in place. Okay.
Karen, can I add something in
Of
there?
course.
Just a couple of thoughts. First, you do also have the option of when you're emailing a request for the team to focus in on problem solving together and you don't feel like they're being responsive, sometimes looping in the district special education director can be helpful. Inviting that person into team discussions or even just contacting them directly and saying, hey, we're kind of struggling to figure out how to move forward. I'd love to hear your input on this, or can you attend the next meeting? That can be very helpful. And in relation to those terms, FAPE, free and appropriate public education, and LRE, which is least restrictive environment, that refers to the district's obligation to provide an education for your child. So a lot of the questions that I was able to see in the Q&A before I lost access to that, I think involve that aspect of it. When you're experiencing resistance with the school in terms of addressing these kinds of challenges, it can be helpful to remind the district that you're all there for the same reason. You want that child at school. You want them to participate. You want them to succeed. And they have an obligation to understand what's happening and address what's happening so that they can ensure your child is able to access their education. And for more information on those things, you can take a look at our website, or as Karen mentioned already, you can contact a PACER advocate to talk specifically about your experience and specific strategies and options that you can pursue.
Next question. What can you do when your child refuses to communicate? They won't share what does work. They won't share what doesn't, even when broken down to yes or no questions. They won't share when given time to think about it either. I'm at a complete loss. It can be really, really hard when your student is not communicating. I know Jeannie in the beginning of the presentation talked about some of these things. Sometimes reframing questions, if you could change one thing at school, what would that be? Sometimes students have a hard time identifying. Sometimes they don't know. Sometimes students walk into school and feel extremely anxious and they can't figure out why. Sometimes there's sensory issues going on and they're really overstimulated, and it's hard sometimes for kids to really understand that that's what's affecting them. I think if they're not able to articulate it, I think then it's up to the adults to possibly do some observing and seeing what information they can get. You know, is the student shutting down always after lunchtime and recess? Is it happening in the morning, in the afternoon, and trying to find some patterns of behavior so we can kind of do some of that detective work since they're not able to share. Sometimes students, for example, like I gave the lunch and recess time, it can be a very challenging time for some students. Um, it could be really overstimulating. There's high social pressure during those times. And especially for a kiddo with social anxiety or sensory issues, and then being expected to transfer right into the next class and behave or, meet expectations. So sometimes if you're finding that, talking with the team about, let's build in a decompression time. Let's build in a break during that time, see if that helps. So I think observing, trying to make changes and seeing if that works and trying to reframe questions. Depending on the age of the child, sometimes having them draw a picture or do other things like that. I've seen sometimes even my daughter in therapy was kind of a picture of a body and just had to draw inside of their body what different parts of her body felt like when she was in certain parts of her school day. So just trying to use different means, sometimes through play, again, depending on the age of the student.
And I think
Yeah.
being sensitive to when we talk to our students also, if they're activated, if they're really stressed, if it, in the morning before school, if they're really distressed, that's obviously not a time that we want to dive into discussions. And I was trying to think about these situations with our kids from the perspective of being an adult, trying to address a problem or communicate about a problem in a moment when we're feeling overwhelmed and anxious. We're just not good at that. Our brains can't handle all that at once. So we were talking earlier in the presentation about sometimes creating a context for communication that feels casual and safe over a fun activity when things are going well can be helpful. Making sure that you're tempering how many questions that you're asking. Maybe ask one small question. Um, that gradual exploration together where it doesn't feel like an interview um, can be helpful. Or just picking up on comments that your child makes and using those as a possible open door to respond. Tell me more about that. It can be helpful ways. But when we're in distress, when we have high anxiety, that expectation for communication and exploration of why can be really challenging, no matter what our age is and what our capacities are. So I know that makes it difficult. It's why having a team of people that work together, often including a therapist and school staff, having that kind of multifaceted approach to talking together about observations can be very helpful.
Yeah, absolutely. And one other thing about that, sometimes if the school avoidance is happening due to bullying, It can be really hard also if students are feeling threatened or a fear of retaliation for them to share that that's going on at school. So again, really having observations, including during social times, can be really important to pick up on that.
Yeah, and I'd just add in kind of another, it speaks to this question, but another just general comment to reiterate some of the things that we were talking about earlier. When we have anxiety, what we're looking for is safety and control. So when we think about a student's anxious tendencies, their avoidant behaviors, their aggression, sometimes related to school, it's easy to respond to the behavior itself. It's easy to allow ourselves to become frustrated because we can't find the answers. But sometimes when we remember to shift that lens back to understanding that anxiety is typically at the root for whatever reason, there may be all sorts of other factors going on. How do we provide safe connection at home with outside providers and at school? Specifically, not only how do we devise strategies for support and communication, but how do we build positive, safe connection people and environments into the school environment to help reestablish that trust and that sense of calm and safety? That's really the starting point for all problem solving, is kind of dialing all the way back to how do we reestablish trust and safety, and then we start building from there.
Absolutely. Um, Hi Norma. So you said hi Karen in your question. So she brings up an example of why it's really important to have a multifaceted approach and really reach out to everybody. She worked with a preschooler who did early childhood screening and noticed that did not pass the vision screen. The mother said that when the school nurse did it, was saying that the child wouldn't cooperate. And they said maybe the child is autistic because they were clinging to the mother and didn't make eye contact. Um, she suggested a medical eye exam, and it turned out that the student had pediatric cataracts and was legally blind and had a hearing loss. So it really is important to check in with your pediatrician as well to make sure there's nothing medical going on, as well as other possible things like anxiety or bullying or things going on at school. Thank you for that, Norma. How do you help a child who feels like no one likes me and is unable to identify a trusted adult at the school? It's really hard. I know kids also oftentimes tend to will generalize, you know, if they have a problem with a interaction, a negative interaction with a student at school one day, they might feel like no one likes me, even though they might have had some other positive interactions with other kids. I think having them, um, I know when I was teaching, I had a notebook for one student who on one side of the page would write down things that didn't feel good that day at school, and then write down things that did feel good at school. And that way, having them think like that, then they can look at all of the things that did go well. I think I think it's human nature to focus on the negative, and not remember those positive things. I'm not trying to invalidate students feeling that no one likes them, because that's a real thing as well. I think again, having a meeting with the school, sharing your concerns, let them know how your student's feeling. They might not know that they're coming home and feeling that way, and maybe the school team can be giving a lot more positive reinforcement, or working with setting up, you know, social groups so that they're feeling that. Um, if they're unable to identify a trusted adult in the school, maybe see if there's somebody that you can identify for them, identify what that would mean to have a trusted adult, what kind of person you're looking for. Um, and work with the team to try and improve that.
Sometimes when a kiddo feels like they're unliked, one consideration might be whether or not they have some struggles with social communication or social skills, and asking the school to take a look into that. Particularly as students grow and develop, if a student has a disability in a specific area, such as social communication, that becomes more evident as other students grow and mature. So that disparity grows and that child starts to feel it. And sometimes they can kind of feel left in the dust by their friendship. So that's one of those areas where you might want to be looking into skill sets. What are we missing? Are there gaps here that we need to address to equip that student to more effectively connect with peers? And I really like Karen's idea there about the list of writing down the positives along with the negatives. We don't want to invalidate the negatives, but our brains do tend to focus on the negative, and particularly for a student who may be inclined toward anxiety, or sometimes behaviors like obsessive compulsive disorder, or even students with autism that sometimes are inclined to fixate on things. That narrative that we learn to tell ourselves can begin to build. So a student may hear or interpret something that feels negative or like a threat, whether it is or not, whether or not that was even an accurate interpretation. And then it starts to ruminate and build, and it becomes transferred to other circumstances, and it can become overwhelming to the point where they don't even want to engage in school. So that's another area where working with an outside provider can be really helpful, or if there are in-school mental health supports. There are a number of strategies and approaches that are used by therapists and counselors that are pretty effective in helping students to work with school avoidant behaviors.
And also building relationships outside of school, depending on the age of the student, but inviting other kids over, increasing play dates, things like that could be helpful. What's the best approach when a child in 4th grade becomes anxious enough to vomit and scared enough to have diarrhea at school in 4th grade? Definitely check in, you know, to try and find what's causing the anxiety. Speak with your medical professionals, talk with the school team, and really try and find out what those as the anxiety is building to that point, try and catching it early and putting in some supports and reliefs for that student. Um, some kids might start pacing. Some kids might start, fidgeting with their hands when they're becoming anxious. So really trying to catch it early, and then support them. But definitely also, I would say, touch base with the medical providers.
Yeah, and that's another area where that data collection becomes really critical. So going back to that discussion about functional behavioral assessment, Karen was talking about looking at kind of the start of triggers. So how do we really zero in on what's causing this? Because if a student is experiencing those kinds of physical symptoms, their distress is pretty extreme. So we want to really understand where that's coming from and collect the data needed, so that we can start working on a supportive program to help lower that anxiety and re-engage them at school. And as Karen pointed out, certainly talking with a medical professional to make sure that there isn't a physical ailment or health issue that needs to be addressed also.
This says, thank you for mentioning school avoidance as a symptom. I have been a truancy officer in New York for many years. The officer with whom I partnered with, the job always wanted to treat truant children like criminals. These were the days a truancy officer could still chase after kids and physically try and stop them. I shudder to think that this kind of behavior towards kids was ever allowed. I believe that because school avoidance is a symptom. Schools can sometimes overlook the effort parents put forth in attempting to get their child to school. Thank you so much for that. And thank you for being the type of truancy officer that you are. And you are exactly the type of person that when we say that sometimes truancy officers can be a really important part of the team. So thank you for recognizing that.
Yes, Andrew, I just want to say, oh, I'm sorry, Karen,
Go ahead.
I was just going to say, I couldn't agree more with Karen. And I'm thankful that you spoke up on that. The lens through which we see a child's challenging behaviors when it comes to avoidance makes all the difference in how we approach it and how we support them. My son, when he was he was like 12 or 13 or so, just really struggled with school avoidance. Mornings were awful, kicking, screaming, crying, distress, getting him in the car. Sometimes we'd get to school and we couldn't get him in the door. It was very extreme, and the district administrative response was to call a police officer, drag him into school, make him go to school. And fortunately, this police officer was just an amazing man. My son is now 22, and we still remember this guy. He was so fantastic. I'm sure similar mindset to what you have, Andrew. And his approach, when asked to intervene, instead of dragging my son into the school in a disciplinary fashion, confrontationally, he decided that he would connect with my son outside and just chat and befriend him. And then they started setting up a pattern where my son would come in, and in the morning the first thing that they would do for 10 or 15 minutes was to play Minecraft together, on a computer, because my son loved Minecraft and so did the SRO. So it immediately established this safe connection, this calm, supportive environment, with someone who was able to bridge that gap of getting into school, starting the school day in a calm manner. And while you probably don't often have a police officer in the IEP, it's kind of an example of things that we can put into the IEP to transition a student back. When they walk through the door, who is a safe person? Who can they connect with right away? Are there points during the day when they can reconnect with someone, and do an activity together, perhaps, that feels calming and restorative so they can stay in school, once they're back in school? So thanks for speaking up on that. I appreciate what you're doing.
So it's a little bit after 1, but I think I'm gonna, and we have a lot of questions left, so I think I'll try and go quickly through some of them. And maybe we can stay like another 5 minutes, Jeannie. Are you okay with that?
I'm fine, yeah, and I
Okay.
can stay quiet here if you want to just
Yeah,
address.
no, feel free to jump in if there's something that I missed, but I'll try and again, if we don't get to your question, feel free to reach out to us. And we're happy to help you individually. Are alternative learning environments more successful for students struggling with these issues rather than schools that do not have alternatives like flexible schedules, etc.? It really depends on the student. There's no blanket answer for that. Um, and if your student is on an IEP, you can work with the team to create a flexible schedule and different modifications through the IEP process. What's best when the school only allows you to speak with the principal, not the entire IEP or appropriate staff members like the nurse or school counselor? You have the right as a parent to invite anyone you want to the IEP meeting. Um, and if you're continuing to struggle with them allowing that, feel free to reach out to us and we can talk you through that. But you do have the right to invite those people. Um,
Well, and it should be.
yeah,
I mean, it is, if your child is on an IEP, it is the obligation of the
yeah.
IEP team to be meeting together as a full team with all members in attendance, because that's the purpose of the team, is to bring all those voices and experience of those working with your student to the table to come up with a plan that will work.
What would you recommend if the child already has mental health services and IEP and is still refusing to participate? Again, work with both your IEP team and your outside services. Maybe they need a higher level of mental health services outside of school. If they're just getting therapy, maybe they need a day treatment. And if they're refusing to participate, kind of find out up to what point, how much can they tolerate? Are they not participating at all? Are they able to manage an hour at school? So work with your team to just kind of find out what you can develop, as well as working with outside supports. Um, Before being considered for testing assessment for IEP, if attendance is a problem, they won't proceed. Any suggestions? So we run into that a lot. an argument that we often make for that is, again, looking at that attendance as a symptom. They're not able to get to school because of this happening. I know that they'll say sometimes we can't do the assessments because the student isn't here. I've had parents who brought students to school after this, kind of towards the end of the school day, or just brought them to school uh, for the evaluation piece, so they don't have to be at school the whole day. Again, work with the team, and if they are refusing to do that evaluation, ask them to put that in writing, and again, with that prior written notice. But this would be a great example, to reach out to us and we can work with you individually. What are Minnesota truancy laws by number of days, and the large picture of how the process looks? So that'll take a long time to answer, but long and short of it, if a student is not in school for 15 days and that is unexcused days, the school is obligated to drop the student from school. That's a funding reason. You can go ahead the next day and re-enroll them in school, but you can find information about truancy laws, I believe, on our website, on MDE website, and also feel free to reach out and talk to us about more specifics. I wish I could get deeper into each of these questions, but I want to try and reach as many as I can. What if your kid is 7? Can you call for help to help them get into the special ed van to go to school if they are escalated, yelling, etc.? That's a discussion to have with the school. Safety is always the most important, both for your student and other students. Considering, would your student benefit from having a para on the van, somebody who's there every day to help them? So again, that would be a conversation to have and see what supports. Transportation is part of, part of the school day in a way, and so supports can be provided. And there is a transportation part on the IEP as well.
And I think
Yeah.
that speaks also to the bigger overall picture of talking with the team. Because if a student is that upset trying to get on the van or the bus to get to school, it doesn't solve the problem of where the anxiety is coming from and how to address it just to get them on the van. So it's one small important piece. How do we get them to school? But we want to have that bigger picture conversation too, so that we can address it on a broader basis as well. And I'm sure that you're considering that and addressing that too. But just a thought there that it's a good team discussion. To talk about the other facets of what's happening at school, so they feel good about getting on a van or a bus.
What can you tell us about partial day attendance plans? So it's really individual. There's no set plan that like, oh, let's do this plan, let's do that plan. It's really looking at that I in the IEP of what does this student need. Some students can only go to school for an hour. Some students can make it to 2 o'clock. Some students have struggled with depression and have trouble getting going in the morning and they need a late start. So it really just depends on the student, and what you and the team are able to what kind of plan you're able to develop to help support them.
And one thing that's important to know is that you do have the right to discuss that. It's the school's obligation to ensure, as we said, that your child is able to learn at school. If they're so overwhelmed by anxiety that they can't get to school, then taking a look at how we gradually reintroduce them to school, how we do that in a way that's safe for them and productive and allows them to make progress is important. Looking at those strategies often includes involving a therapist, whether that's a school mental health professional or an outside therapist, to communicate and collaborate. We want to have a plan together with the school that everybody understands and everyone's on the same page. So how do we do this in a way that reintroduces a child to school environments so that they can succeed in a way that's not overwhelming for them? How do we make sure that everyone that works with that child across all environments at school understands what the expectations are? Because one thing we don't want to see happen is that not everybody knows what the plan is. So the student shows up at school And one or two teachers or staff members may know what's supposed to happen, and so they're able to follow the plan, but others aren't, which creates stress and confusion for that child. So having that collaboration, having it in writing, having agreement about what will happen and when, whether we're talking about adjusted hours for school or any other aspect of this program, is really critical. That continuity and consistency.
Thanks, Jeannie. How have you seen online school options work for addressing school avoidance? Sounds like you've tried online school during COVID was a disaster. You've tried some modified school, and it's not helping. I think we're dealing with autism burnout. Again, each student is individual. What works for one might not work for another. Um, some students do better in a charter school. Some students do better in traditional school. It really just depends. The first part is always identifying what those needs are, and then determining how to best support those needs. What if the middle school principal traumatizes the students and they are not comfortable with them? I would meet with your team, share those concerns. I have seen schools, there are times, I know I worked with one family where there was a similar situation with a school staff, and the team did adjust the student's day so that they did not have to have the interaction with that person. So again, talk with your team and be specific about how are they traumatized, what actions happened, share your concerns and try and come up with a plan. What if the child has some kind of burnout? Is there a way to fix that? Again, what is the burnout coming from? Is the work too challenging? Is it hard to focus or pay attention? Kind of what is it? Again, always trying to go back to that why and then finding some relief. If they're a high schooler, if there's just so much pressure making grades, can we switch classes to pass fail? There's lots of different things. Again, reach out to us and we can help kind of problem solve with you or brainstorm. We've done accommodations, they work for a while, but then something pops up and we're back down avoidance path. Nothing seems to work longer. Again, it's an IEP is a living, breathing document. It can be changed, updated, all times. If you're seeing new behaviors pop up, a new FBA could be helpful. Also, what to do when school stops wanting to try new accommodations. Again, ask them to put their refusal in writing and ask for that prior written notice, which allows you to disagree with their refusal. I feel like I'm making progress to support my child with a great team of providers. I feel like extraordinary effort has been exhausting for me and I'm burnt out. What resources are available for parents to help restore hope and balance as a single mom? I hear you. It can be really exhausting. I noticed there were times with my own children that I got them on track and then I would crash. So I think looking at NAMI, there's other organizations that provide parent support groups, reaching out to other parents who are going through similar things and finding some time for yourself. I know that sounds like a joke sometimes when we're in the thick of it, but finding some time for some self-care, even if it's just going to the grocery store by yourself without your kids. I know it's hard to with being a single parent, but if you have some friends or someone who can step in, sometimes through county services, if you're set up with that, there can be respite and different resources to give you a break as well. So again, give us a call and we can help you with that. Just knowing help direct you to some other resources and organizations. Again, another one with the school refusing to do a safety plan, have them put that in writing. And that'll get you back in the process. I am a mental health counselor. I've seen many examples where the school is not able to provide a safe emotional environment despite parent documentation, clear self-advocacy on the part of the child. IEP meetings attempting to ask for specific help, how to get schools to stop blaming the child and parents despite the family, specifically high functioning autism. Again, this may be a situation where a dispute resolution meeting could be helpful, possibly mediation. there are times where it's not always doable for all families, but sometimes looking for a different environment is needed if trust is that broken or relationships are that damaged and you're just feeling like you don't have, they're not willing to partner and you've exhausted everything. Sometimes looking into different school options. Sometimes our environments can be helpful. Again, reach out to us and we can help navigate with you. How do you handle IEP assistance for students ages 18 plus when most assistant requests have to be initiated by the student who has not initiated any contact? That's a tough one too. Jeannie, do you have thoughts on that one? I mean,
Can you repeat the question? I was writing a
yeah, sorry.
response to.
How do you handle IEP assistance for students age 18 plus when most assistance requests have to be initiated by the student who has not initiated any contact? I mean, again, working with the team.
Um, yeah, so in relation to a student who's over 18, if the parent doesn't have guardianship, um, I'm not sure about initiation. You know, the district has to initiate contact with the student to talk about educational planning in terms of addressing it with the student and any parent discussion that may be permitted or may not. I don't know. You have to talk to the school and find out whether or not there's written approval for communication and planning. But at age 18, oftentimes what's helpful is to ensure if the student is on an IEP that transition programming section of the IEP is robust. We want student buy-in for school, and when students are in high school, if they're on an IEP, part of that transition program section is really intended to help a student look at what they want in life. Where do they want to live? What do they want to do? Do they want to go to school after high school? Where do they want to work? How do we help equip them to succeed and to move into an area of independence? And so the district's obligation to tie those goals and dreams into education and educational planning and the IEP can help that student see meaning in what's happening at school and therefore provide an incentive to address concerns and to graduate. So I don't have enough information to know, where that would be something that would be helpful for a parent to call Pacer and talk through with us. We have a fantastic transition toolkit that talks through everything that should be discussed and included for educational planning for transition. And you can find it on our website too.
So it's 1:20, so unfortunately, I think we're gonna have to pop off. I saw a couple of mentions about school assessments for school avoidance. You will be getting some links to some of our handouts related to school avoidance. There'll be information there. I apologize that we're not able to get to everyone's question, but like I said, feel free to reach out to us. And we're happy to help you navigate this. We know it's been a real issue, especially since the pandemic with school avoidance, and we're here. So, any other
And
final thoughts, Jeannie?
SRAS, yeah, that SRAS is the assessment tool that I'm familiar with.
Thank you.
So yeah, you can take a look into that or contact us for more information. So
Yeah.
wish we had another hour. You guys
I
have
know,
such great
I
questions.
know, I know.
um, yeah,
Well, thank you
somebody
everybody
did.
for joining us. Yeah, go ahead, Jeannie.
Yeah, I just wanted to add one more thing. Somebody did ask in the Q&A if we work with parents outside of Minnesota, and we do not. We serve Minnesota. However, every state has a parent training and information center like the Pacer Center. If you go to Parent Center Hub, either .org or .com, and I apologize, I can't remember. I was trying to put it in the chat, Karen, when you asked me about the question.
Oh, thank
So I
you.
got derailed, but Parent Center Hub, and look up Parent Training and Information Center, and it lists every parent training and information center for every state. So if you're looking for an advocate or someone you can talk to and you live in a state other than Minnesota, you should be able to find a similar organization there that you can connect with.
Thank you. Thanks for joining us, everybody.
Thanks,
Have a
everybody.
good day.
Just a reminder to the people that when I close the webinar, that survey link will pop up and hopefully you can complete the survey, and upon completion of the survey, you will receive see a second link to the certificate of attendance. So with that, I will end today's webinar.
Thanks, Jamie.
Yeah, you're welcome.
Have a good day, everyone. Bye-bye.